The information we're giving is for you to be better informed, not to stay at home and think, okay, let me check Google or let me meet my pharmacist or call my relative at home.
It's important that people who have relatives that are healthcare workers, it's still important that the complete story is known.
Yeah.
Yes.
And then somebody physically sees
The child. Do they have facilities for emergency cesarean section? Do they have in-house pediatricians, or do they have clear referral pathways? Do they have a neonatal intensive care unit, or do they have clear referral pathways to run? Now, these are uncomfortable discussions because many people will say, no, my baby will not need any problem.
It's not my portion.
It's not my portion. Exactly. Nothing makes an adult, a new parent, more anxious than a newborn. A slight fever may often seem sinister, perhaps like a medical emergency. An unexpected cry might feel like the dawn of a devastating illness. And Google searches and ChatGPT prompts often makes things worse. But how much of what we fear is truly dangerous, and how much of it is simply not knowing what to expect? Today, we're going to talk about some of the most important facts to expect in the first critical few weeks of a newborn's life, and how these conversations can protect the babies and their parents. Hi there. Welcome to the Care Conversation podcast by the Patient Doctor Forum Nigeria, a place where we have honest conversations about healthcare, especially those that you don't see often. If this is your first time joining us, we're so happy to have you here. I'm your host, Dr. Emmanuel Sani.
And I'm Dr. Temitope Oyetunji.
And with great delight, we have a special guest, consultant pediatrician, someone who sees both babies and their parent at some of their most anxious moments, Dr. Igoche Peter. Thank you so much for coming.
Thank you. I'm happy to be here.
How are you doing today, sir?
I'm fine. Fine.
Such pleasure. Today we're going to talk about newborn care and Dr. Temitope's newest book, The Smart Parent. Give your child the best start in life. And this book was written especially not just for new mothers, but for even old mothers, to really highlight some of the most important facts that we can see or expect in the first few weeks in life. And we're also going to talk about some of the misinformation and myths that are going around, debunk them, help clear the air, and give you something exciting to work with. But before we get down to brass tacks, Dr. Peter, please, can you tell us a little bit about what it's like and what being a pediatrician entails and what your experience has been like?
Okay, thank you for that question. I'm a pediatrician and I love children. Yeah, so I say we are babies and we take care of babies. So after graduating from the university, we spent some time to do our postgraduate training in pediatrics, and we care for babies, and thereafter we're qualified to be pediatricians, right? So I've been a pediatrician since 2017. Yes, that's getting to 9 years now, right? Yes. So we take care of babies right from when they are born. Let's say till when they are getting married.
Your job ends at 15 years.
So 18 and above, they leave us, right?
Okay.
Yeah, okay, fine. Yes. So, but I know we're talking a lot about newborn here. And when we say newborn, life starts when they are born. But how early they are born matters, because some are delivered preterm,
Right.
some are delivered post-term, and others delivered when they are supposed to be born. So we swing into action as soon as the babies are born, and we are trained to make sure they have a healthy start, right? For some of them, we just need our basic care. For some, we really need to admit. But all the same, we take care of these babies. We see them born, and we see them give birth to their own children when they are supposed to do that.
Wow. You can already
Interesting job.
Right. You can already sense the saturation, and I can tell how much you love your work just from, the aura that comes from how you speak.
Yeah.
Dr. Temitope, you're a family physician. You wrote about a book for a smart parent. What inspired you to write about this book when some would consider it the forte for a pediatrician?
That's a fair question, right? So I wrote the book The books I've written, they've come from maybe an unsettling experience I had, and it's the same with the smart parent. I had an unsettling experience with a father whose newborn was in our care, and we got into a disagreement about if we did what we should have done for the baby or not. I tried to explain the reasoning behind our actions, but he wasn't having it. And the baby was not critically ill or anything. All they needed was a review by the pediatrician. We eventually transferred the baby to see the pediatrician, and the baby was fine. And that should have been the end of it, right? But not for me. That experience stayed with me for days, and it culminated into a book. Because at that time, I had just finished writing The Smart Patient. That was the first book in the Smart series. And I was already thinking of other books to write in that series. So when this happened, it felt like the next right thing to do, to write about this. Because I felt that father did what he did because he didn't know what to expect. And when people don't know what to expect, anything that happens seems like a crisis. It seems like fear takes over where there's no knowledge. That was why I wrote the book, to give parents an idea of what to expect before conception, during pregnancy, during delivery, and in those important first 4 weeks. I felt it was important for them to know so that fear does not fill that gap where knowledge is supposed to be. And that's why I wrote the book.
Wow. Interestingly, Dr. Peter here wrote the foreword for the book, so we're going to be gaining some insights for it.
Yeah.
I've read the book, and I can say it's a 10 over 10. I recommend this for any mother out there, any expecting, any
And
new
fathers
parent.
too.
Yeah, fathers.
You know what? And fathers. Definitely get any parents. That's why it's not smart mother, it's smart parents.
Exactly.
So definitely get this book, and you'll find it extremely useful. It's been stripped of all the medical jargons to make it really easy to assimilate. All right. So this is my copy. Get yours. So let's get down to it. Dr. Peter, why do you think that people refer to the first 4 weeks after delivery or after birth of a child as the most intense?
Yes. So the first 4 weeks of life, which is the first 28 days of life, is a critical period in transition from when they were in the womb to when they are delivered. It's the newborn period is most critical. It's anticipated with excitement, but received with a lot of anxiety, right? Where the parents, a lot of them are not. So every newborn baby is different. So that's why this book is important even for parents who maybe even if you've had 3-4 babies, every baby is different. Right? Yeah. So we have interest in it because we want these babies to survive. If we have survival improved in these babies, the overall under 5 mortality is reduced. Yes.
Wow. Dr. Temitope, you wrote The Smart Parent, the book, even starting from preconception to up to 4 weeks in life. What do you seek? What gaps do you seek to address what were you thinking of when you wrote this book? And how would you say it ties into the whole initiative of the Patient Doctor Forum in Nigeria?
At Patient Doctor Forum Nigeria, we are trying to bridge the gap in knowledge. We are educating patients and educating doctors as well. There's a lot of things doctors assume that patients know that they don't know. So I wanted to bridge that gap. I wanted to expose parents because, every parent, when you take a newborn home, it's like being a first-time driver, right? You've never taken that journey before. So there are a lot of things that are new to you. So I wanted to give them an idea of what to expect, what to do in common situations, how to partner effectively with healthcare workers to give the baby the best start in life, like the book title says. So essentially, I was trying to bridge that gap in knowledge because every new parent would find themselves in that anxious state where they have a lot of questions. This is a new thing they've not done before. Even if they've done it before, like Dr. Peter said, every baby is different. So every time you have a baby, it's a whole, set of new experiences. And I wanted to hold parents' hand through that newborn period and say, okay, this is what you do. When this happens, this is what you can do. essentially, I was trying to fill that gap in knowledge for new parents.
You see, someone who has had a term baby, first delivery, and then the second is preterm. It's a whole new world. Now, the first baby term, second baby term, but that second baby has a medical condition. It's different from the first one. For some people, taking care of a boy is even different from taking care of a girl.
So true.
Every experience is
It's different.
Wow. Yes, I agree. So let's even go into the depth of it. Let's be practical. So what would you say are the things that truly require urgent attention when you're dealing with newborns?
Okay, fine. So I think that question, in medicine, we are taught to think systematically, right? So if I start from head down, right? So if we look at a newborn baby, I know a lot of people are really interested in this space. We call it anterior fontanelle, but the space up where it looks like there is no bone in it, right? Now, we are concerned if it's bulging. If it's bulging, it's important that this one needs attention. Right, you come to the hospital. So I will go down. The eyes, the white part of the eye, which is the sclera, should remain white. So if it's turning yellow, right, you see, so we know that up 6 out of every 10 newborn babies who were born at term would have yellowness of the eyes, 60%. While 80% of preterm newborns will have yellowness of the eyes. So how will parents know which one to worry about, which one not to worry about? I mean, if you see it, come to the hospital, right? It's not something that they will go across the street to a chemist to buy Ampiclox.
That's the favorite one.
Or paracetamol.
Or treat malaria and typhoid.
Treat malaria and typhoid.
For a newborn.
So now, then you go down, if we say the nose, which is the airway. I mean, at any point, the parents discover, this child is not breathing well, right? The slightest impression the parent has, it's better to come to the hospital. Right now, proceed to the mouth, feeding. Now, the baby is supposed to feed at intervals. We say at least every 2 to 3 hours, but we know that at some point it becomes more frequent, right? Now, but if you have a baby who has become, in quote, lazy to suck, the baby is not able to hold the nipple to suck, commonly associated with babies who have jaundice that is not well taken care of, or babies who were so weak at birth that did not cry. That type, you don't keep at home to give glucose water. And then we look all down the baby, any abnormalities. Now, you look at the navel, right? If it's becoming foul-smelling, if it's bringing any pus, bringing any odor, the child should come to the hospital. But if we look at the child as a whole, what is the level of activity of that child? Are we noticing that the child is becoming too dull? Are we noticing that the child is becoming too, maybe one limb is moving unusual, right? Seizures. For such situations, the child should come. And then you carry your baby, you know the normal temperature. Suddenly, baby feels so hot. Just come to the hospital.
And please, it's very important. The information we're giving is for you to be better informed, not to stay at home and think, okay, let me check Google, or let me meet my pharmacist, or call my relative at home, or my relative that is a doctor. It's always better when they are assessed physically. That's how you receive it.
Exactly. So I had a friend, this happened a few days, I have a friend, it happened a few days ago, and he sent me the bilirubin result of another family friend from far north. And I said, well, if I'm to interpret this result, this is good. There is no problem. And say, oh, so it means the child can be treated. I say, wait, that statement means that another doctor has seen. So what exactly is the truth? Say, oh, they are saying the child should be admitted, but if I say the result is not, but I say, look, if a health worker, if a doctor has seen your child and requested for admission, we will not say no just because of this result, right? So it's important that people who have relatives that are healthcare workers, it's still important that the complete story is known, and then somebody physically sees
the child.
Yes. Thank you so much for that. I think that's an important fact.
Yes.
On the other lane now, what are some of the things that scares a parent but could be attributed as normal in this stage?
Well, for example, sleep-wake cycle alters with time. So for some babies, so we as adults, we've adapted to sleeping at night, and we are active daytime. More, you realize that some babies sleep more during the daytime. And they are awake through the night sucking. And so you see the mothers in clinic, they've not slept, they are tired, they feel frustrated, and they are coming with a baby that is sleeping so soundly, right? So I'm telling you, this baby did not sleep last night. So we should consider their sleep-wake cycle sometimes. It's really not much of a problem. We have a problem when the baby sleeps through the night and sleeps daytime. Or the baby is hyper alert, does not sleep at night, does not sleep daytime, right? Good. Then we also talk about when we see some feeding patterns, which we know that baby is supposed to feed. The stomach emptying time is 2 to 3 hours. So the baby that sucks well enough should be able to rest. But baby is now beginning to suck more. We call cluster feeding. That's not a problem, right? So the other conditions, you realize maybe the child is having hiccup, right? Well, it's still good to draw the attention of the healthcare worker, but feed more first and see, because some of them are dehydrated.
Dr. Temitope, your book addresses a lot of what he says, interestingly so. But what would you say sets your book apart? Because we know there are a lot of resources out there that are readily available. So what makes this book different that, our viewers and people interested in purchasing can
to be fair, the internet gives a lot of information. Some of it is very good, and some of it is also misinformation, depending on the source.
Right.
But this book is more than scattered articles online or scattered advice. It's sequential. It goes from preconception to the first 4 weeks of life, even beyond.
Right.
So it's more than anything you can find online in one place. And then another thing is, anyone that is taking care of newborns know that it's a full-time job.
Yeah.
It's something you do, you get tired, you're learning, you're adjusting. So you can never have the time to Google or give ChatGPT the prompts to every question you're going to have.
Right.
So why not own a trusted resource that has done that heavy lifting for you, has arranged everything? And like you said, I made sure there's no medical jargon there. It's just what parents need to know. So it's not like after you read this, then you're going to become a pediatrician. No, it's just what parents need exactly. So it's beyond what you would see online in one place. That is why I did that heavy lifting to bring it all together, just so that patients can have, or parents can have that resource, and then it can help them to fill the gaps in their knowledge so that they can give their baby the best.
Okay, so let me add to that. Since I had the opportunity to write the foreword, apart from the parents that would read this book, and the book does not have the medical jargons, I've seen doctors struggle to explain to parents, and they are using terms that only themselves understand. So I believe that if even healthcare workers, doctors, nurses, so you will learn how to express it as simple in plain language as much as a parent should understand.
Yes.
And then again, it's not something that you just read and discard.
Yes.
Yeah, it's something, it's a reference material. Okay, so for example, you had your first child, you read it, you can still refer to it when next you're having a child. So it's not just, it's a very useful resource. Even if when you finish having children, you can give it to somebody else. Yes.
I think grandmothers should have this.
Yes.
They're the custodian of meats, right? So I think grandmothers are a special subpopulation that should have clear.
Before they go for mugos, they should read this. Yes.
And I think one thing that I love so much about the book is it helps the parents fully enjoy the benefit of the consultation and visit to the hospital, like how to ask specific questions and not seem aggressive, or how to truly express yourself. And for even doctors to see from their purview where they are coming from, maybe asking why a doctor is admitting for jaundice, or why maybe you want a second review of your child. And I think that's also a very interesting fact about the book. You both talked about misinformation and myths. Sir, please, we know that, the information can come from anywhere, from online, from grandmothers, from the Omugo queens. It can even come from preconception as in passed through family lines and culture. So what are some of the things that you've seen in your practice that has affected how, parents have treated care of their newborns?
Okay, there are many, right? So I talked about care umbilical cord care.
Yes.
So you see, I've heard of the one where the grandmother came, that's the mother of the mother, came for Omugo and recommended the use of cow dung to take care of the umbilical stump. Now, this first-time mother was a graduate, and so tried to object. And her mother said, no, that was what I used to take care of your own umbilical stump. Wow. And you are educated, you're a graduate now. So out of pressure, she used it for her baby.
Wow.
It became infected. The baby died. So when I tell parents this, I said, God has a way of preserving some people. Does not mean that is right. Right? Another thing we see is grandmothers, when they bathe the babies, they turn the back, they turn this limb, turn the leg. A child has had fracture before.
You
say yes, because you say you want the bones to be strong. Children have sustained fractures. From that. So we do not want that. Now, you see the idea of saying they want to give glucose water because breast milk has not started, lactation is not established. However, you know that colostrum is important. So colostrum, provided the baby can suck and provided we see something at the nipple of the mother, a baby is sucking, should be enough. But you say no, give sugar water, right? That's not right. And then some people come from village with one type of palm oil. Palm oil is red, but there's this dark one. They want to, after feeding the baby, just add so that the baby will be stronger. I mean, all those things are harmful. I've seen in fact, my first month as a junior registrar, the first case report I wrote was neonatal alcohol intoxication. Somebody was having colic. Somebody, because they say give something, carried methylated spirit and gave the baby. And the baby was intoxicated. Methylated is alcohol. The baby was frankly intoxicated.
Wow.
Right? Baby was hypoglycemic. The blood sugar level was low. We had to resuscitate. So if parents know that these are normal developmental processes, of course, verified by a healthcare worker, right? That should take care.
Wow. To our viewers out there, this is not a memo. These things happen.
Yes.
So this is why conversations and platforms like are here to help inform you. Now let's talk about Dr. Temitope. Let's talk about some high-risk pregnancies for babies that end up newborns that have complications around birth and in their newborn era. We find that we can typically predict to a certain degree when these things can happen. And in pregnancies like that, we call it high-risk pregnancies. And one of the things we recommend in healthcare is that a pediatrician is there to watch after and supervise the delivery. However, in our society and in Nigeria here, we know that there are many centers that don't have the required personnel. Ma, why do you think that is? Why do you think this is an issue in our society today?
It's still an issue because, frankly, there are some centers, like you said, that don't have pediatricians. They don't have NICUs, neonatal intensive care units and all that. There's a problem of infrastructure and manpower given. But then there's also the problem of knowledge. Because, during the reading of The Smart Patients, that's the first book, someone asked me that, so what about mothers who give birth to babies in centers where they don't have incubators and then their baby needs incubators? And my answer to that question was, that is a preparation problem because it should have started from antenatal. And part of the things I wrote in the book is, for a woman, before you register in any hospital for antenatal, there are some questions you must have answers to. Do they have facilities for emergency cesarean section? Do they have in-house pediatricians, or do they have clear referral pathways to pediatricians? Do they have a neonatal intensive care unit, or do they have clear referral pathways to run. Now, these are uncomfortable discussions because many people will say, no, my baby will not need any problem.
It's not my portion.
It's not my portion. Exactly.
But like I said in the book also, that a smart parent doesn't think like that. They
Right.
don't think, no, it will not happen. They prepare. Okay, if it doesn't happen, fine.
Thank God.
Yeah, thank God. But then if it happens, you would have been prepared. So usually sometimes it's just a problem of preparation. And parents should be informed about that. When you're pregnant, you must answer those questions about the hospital where you're going to deliver him. So that's just one cause of that problem. Another cause is some women don't register for antenatal on time. That's why we don't discover these problems in time to be able to, refer them. In other cases, some people, they don't like large hospitals, maybe because of what they've heard about, teaching hospitals or big hospitals. So even when they refer them that go and deliver in this place because maybe your baby might need NICU care, some of them don't end up going because of certain fears. And then there are cultural beliefs. There's a problem of cost. It's layered. There are a lot of problems that cause it. But at the bottom line is parents should be informed about the questions to ask before you go and register in a hospital. You must answer those questions because it makes you prepare. So preparing for a baby is not just about buying clothes and, buying a cot. It's also about making sure that your baby is delivered in the right environment where if they need any help, they can get it.
Can get it. Wow. And just to segue, let's say we've gone through the process of delivery. Sap, what do you think about newborn care in Nigeria? Like, what would you say are some of the things that we see, and what can a parent do to avoid some of these complications?
Okay. So if I get the question right, that's what's the state of newborn care?
Yes, sir.
In Nigeria.
Yes, sir.
Well, so if we are to compare with previous decades, I would say cautiously that we are improving. And I underline that word cautiously. Reason being that Nigeria is among the top 4 most dangerous places to have a baby.
My days.
As a matter of fact, 1 out of every 25 newborn babies born within the first few weeks of life die. And you see, the fact is that these deaths, many times, they are preventable. These deaths are preventable, or the causes of death, they are treatable. But the perspective of I must deliver like a Hebrew woman will make some women stay so long. And even if labor is obstructed, they continue. See, some issues around obstructed labor, which I'm not a gynecologist, but I enter the theater to see. If there is cord round the neck and the baby is not progressing, no matter how that woman pushes, the more the woman pushes, the more there's the strangulation goes on. So just go to remove the baby safely on time, and the baby comes out well. So you see, that is preventable. Then we talk of prematurity, low birth weight as another cause. Now, if these women have good antenatal care and supervised, many times it's taken good care of, right? So we can prevent that. Or even if the prematurity actually occurs, then let the baby be delivered where care can be obtained. We've taken care of babies as low as 25 weeks gestation, babies as small as, we say don't say it in kilograms, say it in grams, 500 grams.
Wow.
500 grams are 0.5 kg, and they've survived. Right? So if you have, if prematurity is inevitable, if it occurs, then let it occur in a place where the babies can be cared for. Right? So all that. So you see, but now let's wrap up all these things. There's this tripod of poverty, ignorance, and leading to disease. So poverty maybe accounts for why some of the mothers may not be able to access healthcare where they should, right? Ignorance, even if you have somebody who is a millionaire and is ignorant, the child won't do well with that, then ultimately ending in disease. So how do we take care of these things in our environment? If it is possible to have any insurance scheme, right? So that out-of-pocket expenditure will be reduced as much as possible. That will help in terms of poverty. I will, because you are saying, what would the parents do?
Yeah.
So I'm not talking about what government will do.
Exactly.
This is what will the parents do. So if they have access to that, then I think that's necessary.
That takes care of poverty.
That takes care of poverty, yes. So, and then for ignorance, the red flags we've been talking about, if they are spotted, one of the things I make sure I hammer with the doctors working with me, do not reassure a patient blindly. Right? So also, the parents should not just let out symptoms just like that. Let me give an example. So I practice in extremes of socioeconomic class, right? Among the very poor people, a child, an infant is very sick, convulsing, and they say, no, don't worry, it's teething. That extent. Don't worry. Child is having diarrhea, is having fever. No, don't worry. They all have it. It's teething. Deworm the child. And then among those who should know, they start giving teething medications as early as 3 months or less. Now, those are those who have the money and should know. Now, both ways, there is ignorance.
Yeah.
So your bank account does not cancel ignorance if you don't have it. So those are...
Wow.
So, to battle poverty, insurance, and to battle ignorance, the smart parents.
Exactly.
Get your copies, you guys.
Exactly.
This is wonderful.
Yeah.
But just to digress a bit, there's a WhatsApp post I saw a few days. I wanted you to comment on it.
Okay.
It was World Cesarean Section Day, and this individual commented this. It says, any woman who gives birth through CS is not worthy to be called a mother.
Wow.
Because what do you mean you cannot open legs and push out a baby?
Are you serious?
See, if I get married, my wife won't be allowed to give birth through C-section. My mother gave birth to all 6 of us through vaginal birth. I won't let any doctor perform C-section on my wife or divorce her.
Ignorance.
This is
That's
real
supposed
life.
to be a joke because in this age,
This is real life.
right?
So
Wow.
we can see that these are some of the issues that you even be telling the woman, Ma, you need this. Child is in distress. You say, let me call. We've had a case where the man was in Lagos. The child was having fetal distress, almost losing the baby. The man says he's about to get on a flight. We should wait for him to come.
Wow.
So he's not poor.
He's not poor.
He's not poor.
So ignorance in this case cannot save your money. Cannot save you, like you said. All right. Let's go into the mind now. We talked about ignorance. Let's talk about the mental part of it in your book, and even here you mentioned a lot of times the smart parent. Can you talk a little bit more about what the psyche of a smart parent is?
When I started driving, they told me about this thing that they tell most drivers actually that when you're driving, assume that the other driver is like crazy or you are the only reasonable person on the road. Right? It doesn't mean that every other driver is reckless. It just makes you more alert, more aware that you need to be reasonable on the road to prevent accidents. So the same way that there is a psyche of a smart parent. They are vigilant, they're observant, they ask questions. They partner with healthcare workers and they don't leave the health of their babies to chance. That's the psyche of a smart parent. And like driving, it's safer. It's safer when you are alert than when you are passive. So the psyche of a smart parent is just that they are aware and they are not passive. They go all out. They don't just pray or hope that everything will work out fine. They make preparations, and where they are supposed to act, they act, and they give the best to their babies. They get insurance, like we have said, and then they arm themselves with knowledge, which is usually best gotten before you need it. So if I would recommend when to read this book, it will be when you start thinking of starting a family or when you're pregnant. That's the best time to read, not when you are panicking and then
you have to make a decision.
Exactly. So, but if you have the knowledge beforehand, you can then go there for reference just to refresh your memory. But then you would have known something before, that occasion arises. So that's basically it. Yeah.
So we're trending toward the end now. So Dr. Peter, I wanted to ask you one final question. If you were to speak to every newborn parent in Nigeria and you were to do a mindset shift, you want to tell them one thing as a pediatrician, an experienced person in this field, what's one thing you would say to them right now?
Okay, there are many things to say, but maybe I'll go through the smart book and choose one chapter.
Okay, maybe one or two things.
Yes. So we see a lot of these myths that parents say, grandmothers. Now, in my consulting room, I've seen where the mother-in-law is a person. So the husband's mother comes with the mother of this baby. And you can see this domineering, you see this young mother really scared. I would say, if you say I should say one thing, then they should read this book.
Okay.
Because I have to do, I end up becoming a counselor in the consulting room. For some, you see the young mother so relieved when I start saying this, right? So I think they will get all they need from this book. But we battle with the myths a lot.
Right.
Yeah.
So you guys, it's not just marketing, it's quality here. So please, I will tell you at the end how to get the book, but for now, just stay tuned. Dr. Temitope, now for doctors, what would you say to doctors who care for these newborns? Like,
I would say to them that parents are mostly, in those moments when they bring their children, they are mostly driven by fear. Like the father that inspired this book, like I said, he questioned my competence. That's just the way to say it. And at that time, I felt attacked. But when I stepped back, I realized that what he did out of fear of the unknown. This was a newborn. He didn't know what to expect. He was afraid. And that is one thing I would like doctors to take note of. That most times these parents, the patients that we see, when they bring that attitude, if you're not able to look beyond the tone, the attitude to the fear, you might just, match their anger with your own, and it does
aura.
And it does no good. We are there to care.
Right.
If there's a mindset shift for doctors, it will be that look beyond the difficult patient before you. Look to that fear that they are having. Address that fear, and you will see that attitude softens.
Yes.
That's one thing I just want doctors to know. Just try to put yourself in their shoes and see how you can just, when you address that fear, you just see that not everybody is unreasonable. Not all patients are unreasonable, actually. So, but if we stop to address the fear, then we'll be able to de-escalate situations, just like we were able to do in the case of this child.
Thank you so much. To our viewers, a baby may not be able to talk, so their parents must speak wisely, and doctors must listen intentionally. Not every cry is an emergency, right? But preparation definitely reduces panic. And we've seen some of the myths and misunderstanding, misinformation. We've tried to do as much as we can right here. And we know that there are gaps in our system, but there's also always something that a parent can do, a smart parent can do to better healthcare. And like we always say, better conversation
leads to better
healthcare. So if you're watching for the first time or you're returning, thank you so much for joining us. Don't forget to like, share, give this to someone, give this podcast to someone, and we'd love to see you again soon. And for this book, you can reach us on all our social media through the Patient Doctor Forum Nigeria. You can always...
And we'll leave a link in the description.
Definitely a link will be there.
To purchase the book.
And you can ask your questions, send in your feedback. We've been getting a lot of feedback from you people, and we're so happy that this has been touching lives, and there's so much more to come. Thank you, and have a good one. Bye-bye.
Bye.